Everyone, in this video, we will look at the difference between paralytic ileus, that is non-mechanical obstruction, and mechanical obstruction of intestine. Paralytic ileus is temporary cessation of bowel motility without any mechanical blockage. It is generalized loss of motility without any physical blockage in the intestine, whereas mechanical obstruction is obstruction to the passage of bowel content due to a physical cause. Here, there is a physical blockage in the intestinal lumen causing mechanical obstruction. Paralytic ileus occurs insidiously and gradually, whereas a mechanical obstruction is a acute or subacute condition. Pain is dull or poorly localized as well as mild in paralytic ileus, whereas the patient has colicky severe as well as intermittent pain in mechanical obstruction. Paralytic ileus shows early and marked abdominal distension, whereas in mechanical obstruction, the distension is late as well as progressive. Bowel sounds, this is very important, are absent or markedly decreased in a patient of paralytic ileus. Bowel sounds are initially increased or hyperactive in a patient of mechanical obstruction, and then eventually they will decrease. Nausea and vomiting are uncommon in paralytic ileus, whereas vomiting is common as well as frequent in a patient of mechanical obstruction. The patient does not pass flatus and stool in paralytic ileus, whereas in mechanical obstruction, initially the patient has constipation and then there is absolute constipation. Temperature is usually normal or low grade in paralytic ileus. It is similar in mechanical obstruction. It only increases if it is associated with strangulation. Lab findings are normal in paralytic ileus, whereas there is hemoconcentration, increased WBC count, as well as electrolyte imbalance seen in mechanical obstruction. Now, let us look at the causes of paralytic ileus. We see post-operative paralytic ileus happening after peritonitis, after intra-abdominal sepsis. If the patient has electrolyte imbalance such as hypokalemia, hyponatremia, patient who is on opioids and anticholinergic drugs, if there is retroperitoneal hemorrhage, patients with severe illness with shock and spinal cord injury can land into paralytic ileus. Mechanical obstruction can happen due to postoperative adhesions, which is the most common cause, due to external herniation, patients of carcinoma, due to intersusception, intestinal volvulus, due to presence of strictures in condition of tuberculosis, Crohn's disease after radiation, or due to gallstone ileus. Let us look at the X-ray comparison in paralytic ileus and mechanical obstruction. So, a generalized distension of bowel loops can be seen in paralytic ileus, but there is no air fluid levels present. Whereas in mechanical obstruction, the dilated bowel loops with multiple air fluid levels can be seen. Hence, the X-ray appears to be having a step ladder fashion appearance. The treatment for paralytic ileus is conservative. The patient is kept nil per orally, given IV fluids. The electrolytes are corrected. The cause is treated. A NG tube is inserted to reduce the distension, and the patient is ambulated. In mechanical obstruction, the treatment depends on the cause of the disease, and the intention is to relieve the physical obstruction. The patient is resuscitated and definitive surgical management is done. Like, share, and follow for more. Everyone, in this video, we will look at the difference